I have the pleasure of inviting Professor Lovell to come down and present on virtual reality for the treatment of people with cancer-related pain. She's a senior staff specialist physician in HammondCare and the medical head of the palliative care services there. She's been leading research in this area for a long time, and I look forward to hearing her speak.
Thank you so much, David, and thank you very much for the opportunity to present. I'm presenting on behalf of Dr. Philip Austin, who's our postdoctoral research fellow who's working on this project, and Professor Philip Siddle, who has done previous work in spinal cord injury-related pain. I'm a palliative care physician with HammondCare and an academic with University of Sydney. HammondCare provides specialist palliative care within northern Sydney and is therefore well placed to do cancer symptom studies. We do those in collaboration with Cancer Symptom Trials Group based at University of Technology, Sydney. Cancer pain is common and disabling, and despite widely available guidelines, more than a quarter of patients have significant pain that interferes with their activities of daily living. The use of opioids in people with cancer is increasing despite the lack of evidence that is optimal therapy in people with chronic cancer pain. So the development of innovative cancer pain therapies, particularly non-pharmacological therapies, is of increasing importance. The use of virtual reality has been shown to be beneficial in some chronic pain states, including fibromyalgia pain and spinal cord injury pain. And there's a little bit of early data looking at cancer patients. It's also been found to assist with anxiety. So our objectives was to assess the feasibility for a multi-site phase 3 study, particularly to determine whether 3D head-mounted virtual reality results in reduction in cancer-related pain compared to a non-immersive virtual reality as delivered on an iPad screen. It's a single-session randomised crossover pilot study. We're aiming to recruit 22 people with cancer-related pain greater or equal to 4 out of 10 on a brief pain inventory pain now item. And they're recruited from inpatient units as well as in the community and ambulatory care. They need to be adults. They can have any type of cancer and any type of pain. So it can be neuropathic, nociceptive or mixed pain, a life expectancy of at least a month. In terms of exclusion criteria, they're really around the experience of virtual reality, so people who haven't got adequate vision won't be able to participate, those who have cognitive impairment, those who can't read or understand English, and those who have a history of motion sickness, because there is a small proportion of people who really get quite significant nausea related to the virtual reality. So we use an Oculus Rift virtual reality head-mounted device and handset. We use Alienware gaming laptop computer and a Nature Trek virtual reality. These are off-the-shelf virtual reality applications. So in terms of the outcome measures, we get basic demographic data regarding the person, their pain, and their other symptom scores. We're using the Edmonton Symptom Assessment Scale and the Australian Modified Kanofsky Performance Scale. Following the virtual reality, we look again at their symptom scores. We look at the brief pain inventory. We look at their experience of the virtual reality using the iGroup Presence Questionnaire and then pain intensity at 5, 10 and 20 minutes. We do a semi-structured interview following the intervention where we understand more about the acceptability of the intervention in this population, how immersed they were, whether they had any nausea and whether their expectations were met. And finally, we're looking at the feasibility, and we're defining that as 80% of people completing the intervention. So the study here, people are introduced to the virtual reality setup. They complete the baseline questionnaires. They're randomised to one or the other first, undergo the treatment. They have a washout period of an hour and then undergo the second treatment and then complete the following questionnaires. At this point, I'd like to welcome any questions.
Thank you very much for your interesting talk. I would like to ask you, is it possible to introduce some kind of biological feedback contour in this research?
Yeah, I mean, that's an excellent idea. And yes, we could certainly do that, looking at pain scores, whether the blood pressure dropped or the heart rate dropped, or you know, other things. That would definitely be a good idea. Yes.
What are you showing them on the VR? What are they seeing?
Yes, so it's a nature scene, and they travel through a field, and in the field there's birds and trees and plants and animals. If their preference is strongly for something that they connect with, there are other scenes they can go to. A lot of people like water, so they can go to more of a water scene if they prefer. And they're quite fun to use. People are welcome to come down and visit us down in HammondCare and have a go at some of these virtual reality applications. Thank you very much.